So this is an investigator-initiated trial that we have performed on behalf of the Israeli CLL study group. And it was for patients with Richter transformation, a phase 2 study where we used 3 drug combination, and we call it the givers, because it included the Venetoclax, Obinutuzumab, and Ibrutinib all together. The study has now an update of almost 2 years, and we recruited in the study 12 patients. The unique things regarding the study is, one, it included a lot of elderly patients. Indeed, the median age of our patient was 76 years old, so usually you don't see such elderly patient in clinical trials. Due to the fact that it was chemo-free regimen, they felt comfortable to be involved. And the second unique aspect of the study is that we had a very rapid ramp up when we introduced the Venetoclax. So the Venetoclax was introduced on day 11 of the study, and it was given in a very rapid ramp up during 1 week or 10 days. So regarding the results, so what we had is quite a nice response when we evaluated the patients after 3 months. So the overall metabolic response was 70%. And when we evaluated them after 6 months, we saw that some of the patients relapsed. So we might conclude that it's a good option to start, like an induction treatment for the Richter, but then we need to get these 3 months of organization and to plan what will be the next step for the patients.